Okay, so with any luck, this presentation is going to work this time. This is about the 5th time I've done this and have been having difficulty, so bear with me as we get this underway. So we're going to be talking about the muscular system. We're going to be covering lots of different things. There's multiple things you need to know about for the muscular system. I want you to be able to compare the 3 main kinds of muscles. I want you to understand the action of each of them. I need you to know the difference between voluntary and involuntary muscles, the 3 functions of muscles, how a muscle is attached to bones, as well as the major movements and disease conditions in the muscular system. So there are over 600 muscles in the body, and what muscles are is they're bundles of muscle fibers that are held together with a connective tissue or this connective tissue sheath. Muscles have several properties. They have the property of excitability, contractibility, extensibility, and elasticity. Properties of muscles, when we think about them, excitability or irritability, what this means is it's the body's or the muscle's ability to respond to a stimulus or a nerve impulse. Whereas contractibility, this is when the muscle gets stimulated, it is going to contract or become short and thick, and this is actually what causes movement. Extensibility, this is the muscle's ability to be stretched, whereas elasticity allows the muscle to return back to its original shape after it was stretched or contracted. All of these 4 properties are very important in muscle, and if one of them is not working appropriately for some reason, for example, a disease or just not using muscle for a long period of time, there can be severe consequences. We have 3 major kinds of muscles. We have cardiac muscle, visceral or smooth muscle, and then skeletal muscle. Cardiac muscle, this is the muscle that forms the heart, and it contracts. When that muscle contracts in the heart, it actually squeezes. For example, it squeezes the top and then it squeezes the bottom, and this is what pumps blood. So cardiac muscle is considered involuntary, and involuntary means that we do not, sorry about that, involuntary means we do not have conscious control of the muscles. Visceral or smooth muscle, this is a muscle that is found in the internal organs. Earlier in the year when we talked about peristalsis in the digestive tract, peristalsis, that is that rhythmic motion of muscles, and so that is what's happening in the smooth muscle, and we again cannot control that, so that is involuntary muscle. Skeletal muscles attached to bones, and these are the muscles that cause movement in the body, and these are for the most part voluntary, so we have control over their actions. Functions of the muscles, so when muscles attach to bone, and then these are going to provide voluntary movement. So one of the functions of skeletal muscles is to provide movement. Another is to produce heat or energy. As muscles are contracting and working, they produce heat, and they also can be burned for energy. They help us to maintain our general posture just by being in a state of tone, and we'll talk about that in a little bit. And they also protect our internal organs. If you think about the skeletal muscles of the abdomen, if somebody goes and punches you in the stomach, you automatically tighten up those muscles, and it helps to protect them, the internal organs. The way muscles attach to bones is through tendons. So tendons attach muscle to bone. Tendons are strong, tough tissue, and you can actually see tendons sometimes. Like if you buy a tenderloin, in those strips of meat you can see the tendons. You have to go in and actually remove them. Also, you can see what's called the fascia. That's that sheet-like membrane that covers the muscle. So we'll peel that fascia back on a steak or a piece of meat, because otherwise it's pretty tough. And when we think about attaching muscle to bone, we have two attachments. We have the origin and we have the insertion. The origin is when the muscle attaches to bone, and one end is the origin. That's the end that does not move, whereas the other end, when it attaches to the bone, is the insertion, and that's the end that's going to move when contract. So if you think of the bicep, the origin is going to be at the shoulder, whereas the insertion is going to be down at the lower arm. We have 5 or 6 major movements, and so you need to understand each of these actions or movements of muscles. So muscles can adduct, which means they can move the body part in towards midline or towards the body. We can abduct, or abduction, this is moving away from midline. Flexion is decreasing the angle between two bones or bending a body part, whereas extension is increasing the angle between two bones or straightening the body part. There's also rotation. Rotation is the ability to move a body part on its own axis. So for example, that would be the head going side to side, whereas circumduction is moving a circle moving an extremity in a circle at a joint. Now, not all joints are able to do circumduction. You know, a hinge joint can't circumduct, but things like the arm, ball, and socket joints can circumduct. Here we're looking at the major muscle groups in the body. So you are going to need to know kind of what some of these major muscles do. For example, you're going to need to know the sternocleidomastoid, and you're going to need to know the trapezius. You're going to need to know some of those other muscles and exactly what those movements are. Here they are from the back. So the trapezius is one of the muscles also we're going to be talking about. Now, this is not included in your notes, so you're going to need to add this additionally to the notes that you have in front of you. The sternocleidomastoid, this extends from the sternum upward along the side of the neck, and it turns and flexes the head. The trapezius, this is a triangular shaped muscle located in the upper back and neck, and it extends the head and moves the shoulder. The latissimus dorsi, this originates from the vertebra around to the chest, and this extends and abducts the upper arm, whereas the pectoralis major originates from the sternum. It crosses over to the humerus, and then it adducts and flexes the upper arm. The deltoid covers the shoulder joint, and it's going to abduct the arm. Now, this muscle is one of the muscles that we use frequently when we talk about injections. So that's, you know, when you think about getting a shot in the arm, that's the muscle they're talking about, the deltoid. The bicep brachii, this is going to flex the lower arm, and it is going to supinate the hand. It's in the upper arm. And the tricep brachii, this is also in the upper arm, and it's going to extend or adduct the lower arm. The gluteus maximus, this forms most of the fleshy part of the butt and extends and rotates the thigh. And again, this is another muscle that we use frequently as an injection site. The sartorius, this is the front of the thigh. It abducts the thigh and flexes the leg. Whereas the quadriceps femoris, this forms the anterior part of the thigh and helps extend the thigh. And then the hamstring muscles, this is a group of three, the semimembranosus, the semitendinosus, and the biceps femoris. And these muscles are going to help flex and extend the thigh. The gastrocnemius, this is a main muscle of the calf. When we think about cramping, we're going to talk about that a little bit later on, muscle cramping. This is a muscle that oftentimes cramps up. It attaches to the heel bone by way of the Achilles tendon. The Achilles tendon is pretty well known and recognized. Most of us have heard about that. And this muscle is used to plantar flex the foot and flex the toes. So plantar flexion means that the toes or the foot is moving towards the ground. The tibialis anterior, this is going to be positioned on the front of the leg and is used to dorsiflex the foot and then turn the foot inward. So when we talk about dorsiflexing the foot, we're talking about pointing the foot or bringing the foot up towards the body. So the next thing that we're going to talk about is muscle tone, and muscle tone is a state of partial contraction. The muscle is just kind of always ready to move. It allows us, it allows us that ability to react instantly. Loss of muscle tone can be a huge complication or a huge debilitating factor for patients. So it's something we really need to think about. It can occur in severe illness. It can occur with things like paralysis. It can also, a loss of muscle tone can occur when the muscles are not used for a long period of time. They can actually atrophy, which means waste away. So they actually get smaller. They lose their bulk, so to speak. When we lose muscle tone, if those muscles are not moved and those joints are not flexed and extended, etc., if we don't put the joints through range of motion, you can end up with a severe tightening of the flexor muscle. So we think about these muscle groups. One muscle is going to be the muscle that's going to flex that joint. So for example, in your arm, it's your bicep. That's the flexor muscle. That is going to flex the arm in or decrease that angle. And that is the stronger of that muscle group. Whereas behind it, if the bicep shortens and contracts, then the tricep is kind of stretching, but because it loses its tone, it just kind of is flaccid. It can't fight against that bicep. So what happens is that arm ends up flexing up and curving in, and that, when we end up with a contracture, that's something that will not go away. So we see this commonly, at fingers and wrists, knees, and other joints as well as the neck. These joints can all be affected by contracture. Once contracture starts to occur, it can be impossible to fix that. When we think about some of the diseases and abnormal conditions related to the musculoskeletal system, there's several that come to mind. So we're going to talk about fibromyalgia, muscular dystrophy, myasthenia gravis, and then we're going to talk a little bit about muscle cramps and spasms and strains. Fibromyalgia, this disease, it's chronic, widespread pain. Throughout the body, and people with fibromyalgia get very frustrated because they feel like people don't believe them. You can't really see it. You can't see anything specific. It's very hard to, there's no definitive diagnosis as far as a test that we can say, oh yes, that's fibromyalgia. So sometimes people get very frustrated with this disease. So symptoms can be muscle pain and stiffness, some tingling, maybe not sleeping well, and definitely depression. Again, we don't know what really causes it. It could be, genetic. It could be due to poor physical fitness, although I've had patients who are very physically fit that have fibromyalgia. Now they lose their fitness because they lose their ability to move, but it wasn't caused from that. Treatment, we're really looking at pain relief. We do some supportive stuff. We're in like physical therapy, maybe acupressure or acupuncture, and some medications to help relax muscles, some also to help with the depression. Muscular dystrophy, this is a group of inherited diseases, and muscular dystrophy, this leads to chronic progressive muscle atrophy, so they lose their bulk and their shape. It's really very frustrating again and sad for people that have muscular dystrophy. It oftentimes leads to early death and total disability and appears in early childhood. Now, there's tons of research being done and progress being made, but it still can be very frustrating. Myasthenia gravis, chronic condition in which the nerves impulses are not being properly transmitted to the muscles. And this is going to lead to progressive muscle weakness and paralysis. If the muscles are not able to receive or are not receiving that impulse, then they are not going to do what they should be doing as far as contractibility, extensibility, etc. Now, if the respiratory muscles become involved without mechanical respirations, people will die. We don't know what causes it, maybe autoimmune, and again, treatment is just supportive. Muscle spasms or cramps, this is where you have a sudden, involuntary, and it's painful contraction of muscles. So we think about with muscle spasms or cramps, we think about people jumping out of bed in the middle of the night, with their legs in great pain and they're trying to stretch that muscle out. But we also see this happening frequently, in athletes on the athletic field or while they're competing, because sometimes it's just from overexertion or you might not have enough electrolytes. This can also be due to poor circulation. So the way we treat it, we just have gentle pressure and stretching of that muscle to try to relieve that spasm. And also for muscle spasm, we're also going to, make sure people are hydrated and make sure they have electrolytes. So then talking about strains, this is the overstretching or injury to a muscle or tendon. Oftentimes we'll see strain in the back or the arms and the legs, ankles, wrists, feet. And this can be caused from prolonged or sudden muscle exertion. For example, you didn't really warm up very well. That's why warm up is so important. You're going to have pain, muscle pain, so myalgia, that means muscle pain. We're going to have edema or swelling, and then limited movement as well. And when we talk about muscle strain, the treatment for that is resting, muscle relaxants, pain medications. We're going to use heat and cold applications as well. So we have covered the musculoskeletal system. Make sure that you go back and look at your key terms and that you get all those muscles that were not included in your notes. You need to make sure you have that information and expect to see that on the test. Thank you.